We will convene the March 22nd Health Subcommittee meeting, and looks like we're okay. Go ahead, Madam Clerk, if you'd call the roll.
Representative Boyd, Representative Byrd, Representative Freeman, Representative Hall, Representative Jernigan, Representative Kumar, Representative Marsh, Representative Ramsey,
Here.
Representative Sherrill, Representative Smith, Representative Terry. Chairman, you have a quorum.
Thank you, Madam Clerk. Do we have any personal orders this morning or this afternoon? If none, we will move to our calendar. We have had some reshuffling. If no objections, we will look at, we had a addendum calendar with a bill from item 27, House Bill 2290 by Leader Gant, and he has asked us to move him to the top of the calendar here. So I will do that, and I will first recognize Dr. Pardon? Okay, we have a proper motion and second on the bill, and I was asked to recognize Chairman Terry.
All right, thank you. And having had discussions with the sponsor on this and knowing that there's other pieces of legislation that are dealing with similar issues, I've asked that this does need to be looked at a little bit more as we're dealing with other bills, so I'd like to make a motion to send this to summer study.
We have a proper motion and second on the summer study movement. Anybody want to discuss that? Any questions? Or if not, we'll be voting to send this bill to summer study. All those in favor say aye.
Aye.
Any opposition? So approved. Thank you, Leader Gant.
Thank you, Chairman and Committee.
We have been asked, item 1, House Bill 2096, we've been asked to roll that
Just a couple spaces.
2 or 3 spaces. We'll roll that 2 spaces and take up item 2, House Bill 1870. And Chairman Hulsey, you're recognized.
Thank you, Mr. Chairman, and thank you, committee. I just want to speak to this bill a little bit, and then I'm going to make
Let's get a motion and second on the bill. Have a proper motion and second on the bill. Yes, sir, you can discuss it.
Thank you so much. This was called a doctor protection bill, and the reason I ran it is because the pressure seemed to come from the FDA down on doctors in this state who work very hard with COVID issues to try to solve them. Most of mainstream medical's protocol for somebody who tests positive is to go to your house and lock yourself up in there, and if you get to where you can't breathe, go to the emergency room. Understanding that when you go to the hospital, your chances of dying kind of go up a little bit, and if they shove a pipe down your throat, they really go up. So there's a group of doctors in this state, several of them, who said that's not good enough. We need an outpatient protocol treatment. And so they worked at one, and they found things that worked. There's a group of doctors on the east end of the state that I met with about 3 months ago that have designed a protocol. It's about a 5-step process. As soon as you test positive, collectively, they have treated over 8,000 people, and they have not lost one. Now, the whole purpose of this bill was the FDA seems to be putting pressure on regulatory boards to stop anything out of mainstream, whether it works or not. But having said all that, the Senate trashed my bill. So I wanted to get that off my chest. There's no sense in running it, so I'm asking Mr. Chairman if you will take this bill off notice.
In the nature of giving you a sense of freedom, then I'll let you get that off your chest.
Thank you, sir.
So approved. We will move on to item 3, and I suppose your chest is heavy once again, and we'll let you get this one off your chest.
Not as heavy. Not as heavy.
We have a motion and second on House Bill 1960. Have a proper motion. And a second, we have an amendment that makes the bill. We will go ahead and put that amendment on. I think it's 14051. Is that correct, sir?
That's what I have, sir.
And we have a proper motion and second on the amendment. We'll be putting the amendment on the bill. All those in favor of the amendment say aye. Any opposition? We're back on the bill as amended. You're recognized, sir.
Thank you, Mr. Chairman. All this does is fix a problem that was caused in October when we met in special session. Back last session, this committee passed this bill. The full committee passed this bill. There was a bunch of arguing and fussing went on with it, but you did pass it. And it went to the House floor, and we passed it. It passed on the Senate side. It was a simple bill. It said the state government and local government can't force somebody to take a COVID-19 vaccine against their will. Somehow in October, that got bound up in the COVID bills that we passed in some big, huge omnibus package, and it ended up with a sunset on it. And that was never the intention of the bill. So what this bill does, it takes the sunset date off of it and puts the bill back to where it was and what we voted and what we passed. And that's about it.
Okay, do we have any questions or comments on the bill as amended? If none, we will be voting to send this bill to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Mr. Chairman. Thank you, committee.
I can tell that you're lighter in your heart.
I am.
today.
I feel much better.
We'll move on to item 4, House Bill 2017. Oh, I'm sorry. Leader Lamberth, you had asked us to move yours a couple of spaces. We are at that point. You, sir, are recognized on House Bill 2096. I'd ask for motion and second on the bill. We have a proper motion and second. Is there an amendment, sir?
No, sir, Mr. Chairman, there's no
Okay.
amendment at this time.
We will recognize you to explain the bill.
Thank you, Mr. Chairman, and thank you for taking me up. I apologize for being a couple of minutes late. It's very simple and straightforward. If the feds permit us to require work requirements on different welfare programs, then we will do so, working with the different departments to make sure that that is appropriately utilized. But right now, we do have the ability to be able to require work requirements. It's been shared with me by several of these departments that work on this, that most of the folks that are on several of these short-term benefits, like TANF or SNAP, I mean, they actually are working. And so most of this is just going to be to ensure that that policy is being implemented. Because we want these folks to actually work up out of poverty, not fall back further into poverty. So that's the goal, is to get folks either, and I should have said working or in work training. So it's one or the other. So we just want to make sure folks are able to use that time when they're on the program to benefit themselves, not fall further back.
Okay, do we have comments or questions on the bill from the committee? The question's been called for. If there are no objections, we'll be voting to send this bill to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Mr. Chairman, members of the committee. Y'all have a wonderful day.
Thank you, Leader. We will move once again item 4, House Bill 2017 by Chairman Reedy, and I think that's been taken off notice. Item 5, House Bill 2835 by Chairman Reagan has been taken off notice. Item 6 by Chairman Cochran, House Bill 2629. I think he wants to say a few words about it. Do we have a proper motion and second on the bill? And you are, I didn't catch that. I know, yeah, but we want you to get this off your chest, Chairman.
Thank you,
so
Chair. Yes.
You're recognized.
Thank you, Chairman and committee. We appreciate the therapy you are providing all of us today. I appreciate your patience over the last several weeks. And so what this bill has facilitated is bringing physicians' assistants, nurse practitioners, and just general practitioners to the table, trying to figure out kind of what that proper role is to maybe give it to getting to some more practicing privileges, perhaps for nurse practitioners, physicians' assistants. Really kind of in filling that void, especially in rural healthcare. There's, unfortunately, we do have that shortage of general practitioners in rural areas, and just, again, trying to find that proper niche and that proper mixture. But it's brought everyone to the table. The Senate and House leadership will be putting together a task force of all these individuals trying to figure this out for next session. I think we're really close. to getting something that works for everyone. But I know I've rolled this to the heel several times as we've continued these negotiations. So again, just wanted to come up. Thank you for your patience, and look forward to working with you next year, because I think we'll be there and we'll have a solution with you. But with that, and again, thanks for the therapy. I'll take it off notice.
Thank you, sir. Do we have any comments or questions since we have a motion and second on the bill? If none, thank you very much.
Thank you very much.
We'll move on to item 7, House Bill. Oh. We'll move on to item 7, House Bill 2314 by Chairman Griffey, and I think he is not here today, so with no objections, we will roll that to the heel. Move on to item 8, House Bill 2416 by Chairlady Moody, and I think she told us that she might be late today, so we will roll that to the heel. On to item 9, House Bill 2451 by Chairlady Weaver. You are recognized. We have a proper motion. Do we have a second on the bill? No second, fails for lack of a second. Excuse me, no, sorry, but, well, we just take it up with the committee members later. I can't change that. Takes us to item 10, House Bill 2746 by Chairlady Lynn. You are recognized.
Thank you, Mr. Chairman.
I'd ask for a motion and second, and do you have an amendment on this?
I do. I have an
Okay.
amendment that makes the bill.
Motion and second on the bill, and do I have a motion and second on the amendment? Does it make the bill? Oh, pardon me, I'm told that you have 2 amendments.
We are going to use Amendment 014995.
Does that make the bill?
That makes the bill.
Okay. We have a proper motion and second on the amendment. Do you have a motion? Do I have a second on the amendment? I have a second on the amendment. Go ahead, and we will put that amendment on the bill. All those in favor of amending the bill as so mentioned, say aye. Any opposition? We're back on the bill as amended. You're recognized, Chairlady Lynn.
Thank you very much, Mr. Chairman. Ivermectin has been seen and called a miracle drug. It has saved the lives of billions of people over the world. Time and again during the pandemic, it was found to be effective when taken early enough for people who were diagnosed with COVID. Studies have since proved its efficacy for COVID, but during COVID, its off-label use was considered suspect, and so it was restricted. This bill will permit ivermectin to be dispensed behind the counter at the pharmacy by pharmacists. There are several details in the bill that makes procedures for pharmacists to do this. But that way, if you are a person with COVID, you can go to the pharmacy, and the pharmacist will look at the drugs that you're taking now, see if there's any drug interactions, and prescribe you or let you purchase a blister pack of ivermectin that you can take early in your illness so that hopefully you will recover and not have to worry about hospitalization or maybe even infecting loved ones in your household or who want to come see you. Mr. Chairman, I have a doctor here to testify, if you would permit that.
Yes, I think you do have testimony already prearranged. Do we have any objections to going out of session for testimony? If none, we're out of session. You can
Thank you.
bring your testimony up, Doctor. Yeah, you can introduce yourself, please. And we have 3 minutes.
Thank you. Thank you, Chairman, certified internal medicine physician from Johnson City. I've treated COVID over the last 2 years, over 4,422 patients now. The story of I have no financial conflicts and no conflicts of interest. I've not charged any patients for treatment. The story of ivermectin is one of early treatment. Treatment works for both vaccinated, unvaccinated, anyone that has COVID. Early treatment is the key, and it is absolutely necessary that we allow our citizens of Tennessee to have access to this early in the course of their disease. It is an extremely safe drug that's been used since 1987. It's FDA approved. It is it shares the course of aspirin and penicillin in that it was derived from nature. It was found in a golf course in Japan in the soil, a saprophytic organism that made this medication. And it's been purified and used in over 79 countries. It was lauded by its manufacturer, Merck, as a wonder drug. It was used humanitarianly in the treatment of parasitic diseases. It also has antiviral and anti-cancer activity as well as anti-inflammatory activity. It's on the WHO's list of essential medicine. It was instrumental in the treatment of river blindness in Africa, where over 50% of the males age 40 and over were blind because of river blindness, and that has nearly eradicated that disease. It's been given weekly, monthly, annually to many, many people, 4 billion doses safely. There's only 2 medications that you can't use with it. It was even recommended by the WHO that non-medical trained personnel could administer this drug in Africa. So it is very safe. In my own practice, my own experience, I've used buckets of it in this COVID area. I used it before for scabies, lice, parasitic infections of missionaries. I had much experience with it before I used it for COVID. In the use of COVID, there are over 81 studies that verify its efficacy. It is a very safe and effective drug, both in the prevention, treatment, and reducing severe disease. It reduces hospitalization and deaths by 85%. And that's a substantial amount of benefit for the people of Tennessee. And I ask you that in the setting of a potentially fatal disease, that there is no downside to the safe medication, and that we would allow early access for the patient to use this instead of resorting to the veterinarian form at Tractor Supply. And that is our aim with this bill. Thank you.
Okay, and thank you. Do we have questions or comments of our witness? Speaker Marsh, you're recognized.
Thank you, Mr. Chairman. And how will this work? It will be behind the counter, and you don't have to have a doctor's prescription. So you just talk with the pharmacist?
Yes, sir, you're recognized.
Thank you. Thank you, Representative Marsh. Actually, it's going to be under a standing order. That means that a doctor, either a doctor in the community, or we had even talked about a statewide physician issuing a standing order. That is, these people could have it at this dose with these indications, and they couldn't have it if they have these certain things. So it would be a standing order, sort of like in the hospital, there are some standing orders for nausea and that kind of thing. So it would be a very predefined list of folks who could qualify for this, and then the dosage would be set. It's weight-based, so it's pretty easy. Thank you, sir, for that question.
Thank you.
Thank you. And I might add, we have developed that kind of a program for Narcan availability.
Yes, sir.
The Department of Health has written a prescription from the director of the Department of Health, commissioner, and so collaborative pharmacies all across the state can make that available kind of over the counter. So it'd be kind of a similar situation.
Yes,
to that.
sir.
Yes. We have Dr. Kumar, you're recognized.
Thank you, Mr. Chairman. Thank you, Dr. Sibley. We respect your experience and the work that you have done. I agree with you that it's a safe drug overall, having been used extensively. You mentioned 81 studies that, I don't know if you use the word overwhelmingly, but I get sense that it's overwhelmingly effective. The studies that I see, including an article in the JAMA within the last week or so, they're marginally effective to not effective. No harm, but I did want to clarify that, again, studies don't universally prove the point that it's as effective as you're saying it is.
You recognize Dr. Sibley?
Thank you, Dr. Kumar, for that. And you're referencing a February 18th, 2022 paper out of JAMA, the iTech randomized clinical trial, where they looked at ivermectin treatment on mild to moderate disease. This was a very small study. It was underpowered. That means that the sample size was very small, about 260 people in each of the arms. There were a couple things with it. It was open label. That is, the physicians knew who were getting it and who weren't. It was conducted in the hospital, and that was around day 5 to 7, so clearly not early treatment. There was no breakout or mention of vaccination status. There was no zinc or other vitamins given with it, which is absolutely essential for its mechanism of action. It's a zinc ionophore. That is, it helps the zinc to get into the cell, and if I don't have zinc, then it's like starting my car without gas. If you actually look at, so their endpoint was reducing the use of oxygen. Did it help the patients not have to use oxygen? That was the primary endpoint, not death and not hospitalization. So if you break that down, actually there were 3 people in the ivermectin that died and 10 in the control group that died. Now, they said that wasn't statistically significant, but there were actually 12 because 2 people didn't even make it to the end of the 7-day study. So there was actually a 70% reduction in death. And there was a reduced mechanical ventilation, 4 versus 10. So it depends on what kind of endpoint you want to pick on that. The sample size was very small, and there were a number of issues with that particular study. That is certainly one that was most recently come out. So is there additional questions I could ask or answer for you, sir?
Dr. Kumar.
Thank you. No, thank you. Yeah, I think you explained it very thoroughly. But that was just one study. But
Yes, sir.
A number of
Yes,
other
sir.
studies that have come
Yes,
that have
sir.
shown marginal improvement to no improvement, the ones I have seen.
Yes, sir.
But also in this standing order, is zinc and other vitamins going to be a part of the standing order?
Yes, sir.
Dr.
There
Sibley.
new. Oh, I'm sorry. Yes, sir. Chairman Ramsey. Thank you. Yes, sir. Vitamin C and vitamin D are nutraceuticals that are used as part of that, and then that's over the counter obtained, and then the ivermectin we would not go beyond that. There are other things you can add in a protocol, but that would be under an individual physician.
Dr. Kumar.
My question was, is this, supposing we were to pass this bill and in the state of Tennessee, it is allowed that there is a standing order signed by one physician who theoretically will be giving this medication just without seeing them to thousands of people, how maybe COVID will die away and we won't need it. But to a lot of people, when people pick up their ivermectin, would they also be given zinc and other vitamins that you're recommending?
And Dr. Sibley.
Is this a part of the bill?
Yes, sir.
Thank you.
I'm not sure that it's not mentioned in the amendment, but that would be something that there would be instructions on how to use the medication. And certainly nutraceuticals, most of the folks, even in Tennessee, are already on some vitamin D and C because they know that works, and zinc. But that I would like to include that on there. So
Dr. Kumar.
Thank you. Thank you, Dr.
Thank you,
Let
sir.
me recognize Mr. Bajoy. I think we have some confusion on the bill. There, Representative or Chairman Lady Lynn, you had 3 bills on here. This one is a collaborative pharmacy agreement, and I think you're confusing it with a standing order from one of the other bills. Yes, Mr. Bajoy, go ahead.
Joel Bajoy, Office of Legal Services. I just wanted to clarify that House Bill 2746, as amended by 14995, permits a pharmacist to provide ivermectin to a patient pursuant to a valid collaborative pharmacy practice agreement, which is an agreement between individual or multiple pharmacists and an individual licensed physician or someone else with prescribing authority. And that is not a standing order, which is done by the chief medical officer of the state and doesn't require an agreement between pharmacists and another physician. Thank you.
And Dr. Sibley, is that your understanding?
I'm looking here at the Senate bill, the amendment. So it does say valid collaborative pharmacy practice agreement, which a non-patient specific prescriptive order and standardized procedure. So I took that to mean standing order. I'm sorry,
Yep.
but that might have been a vocabulary
Sure,
misuse of mine.
Understand.
Sorry about that.
I just wanted to make it clear. Do we have other comments or questions of our witness? If none, you've done an excellent job.
Thank you, sir.
And we appreciate you so much.
Thank you so much.
We are back in session. Chair Lady Lynn, you are recognized.
Thank you, Mr. Chairman. As the doctor testified, ivermectin is safe. It has been proven effective in many tests. And if you think about how most people, or many people, get diagnosed with COVID, they're feeling ill. They maybe run over to the pharmacy, grocery store, and they buy one of those little at-home tests. They take the test. They're not at a doctor. They're at home in their kitchen, and they're scared. What do I do? And maybe they talk to a friend, and they say, run over to the farm store and get some ivermectin. That's just not a good idea, and we don't want our citizens doing that. This is such a better way to allow our citizens to get this very safe and effective drug. And, take it early. As soon as they're diagnosed, take it early. Comes in a little blister pack. There's only a few pills. When it's gone, it's gone. And hopefully they can avoid getting extremely ill or spreading it to family or anybody else who we certainly would never want to get sick.
Okay, do we have any comments or questions to the sponsor? Speaker Marsh, you're recognized.
Thank you, Mr. Chairman. And I'm a little bit confused because I thought the doctor said it was name specific. So you're saying that if you don't have to have a prescription, you don't even have to have a doctor put your name on a list. You can just go in and go to the pharmacist and request it. And what does the pharmacist have to check to give it to you?
Chair Lady Lynn.
So the bill has the Board of Pharmacy adopt rules to establish standard procedures for the provision of ivermectin. But to give you an idea, they might ask you questions. Do you have COVID? No, I think I have worms, whatever. But do you have COVID? Yes, here's my stick. I have COVID. How much do you weigh? Are you on, there's only one drug that I know of, but the doctor said there's a couple of drugs that have interactions, and one is clozapine. It's a heart medication. So are you on this heart medication? Also, the pharmacist may have access to the drugs that the person is already taking in their computer system. The pharmacist would be able to check that as well. So once those few things are checked, the pharmacist then would safely be able to determine what a dose would be and dispense that to the individual. And they would get a sheet too. It's right in the bill. And of course, they would be counseled about follow-up care. Go to your doctor. You're sick, go to your doctor, all of that. But it certainly seems to me like a far better idea than what has been happening that we've heard about and spread on social media.
Speaker Marsh. Do we have further comments or questions? Dr. Kumar, you're recognized.
Sir, thank you. Just curious, has any other state done something similar?
Chair Lady Lynn.
Yes, there's a few bills running in other states. New Hampshire just passed a bill. Actually, their bill is far less restrictive than ours. Their bill puts ivermectin on the shelf, over the counter. So just like you'd walk up and maybe you'd buy some Tylenol or vitamin C or zinc, that's where the ivermectin would be sitting because it does have a couple of drug interactions, I think it's a better, and it's weight specific, it's probably a better idea to have that consultation with the pharmacist. And that's what this bill does. I think we could feel really responsible for making this drug, the safe drug, widely available, but also having the consumer, the patient, talk to the pharmacist and have that thorough screening.
Dr. Kumar?
Thank you. That's helpful. So what about adding zinc and vitamins to the pack?
Chair Lady Lynn?
Oh.
Should there be, I mean, it's not in this bill.
Next bill.
Thank you, Mr. Chairman.
Do we have further comments or questions of the sponsor? The question has been called. If no objections, we'll be voting to send this bill as amended to full committee. All those in favor say aye.
Aye.
Any opposition? So approved.
Thank you, Mr. Chairman.
And you are recognized on item 11, House Bill 2504. Do we have a motion and second on the bill? Have a proper motion and second on the bill. You're recognized. I think you wanted to say a few words about it.
I did. I think this bill is this is the bill about the protocol on the Department of Health's website. You know, the Department of Health has a lot of information on their website. If you are someone with diabetes, if you are a pregnant woman, maybe at risk for certain things, if you have smoking, if you smoke and other issues. There's a lot of information on our Department of Health's website for people who have those conditions or do those things, which I think is a great idea. I really do. It's just practical. It is tried and true, and it's all organized so someone can really read it and understand this is how I can protect myself. With COVID, nothing went on our Department of Health's website for at-home care. And when constituents were calling me, they were telling me that their physician didn't give them any information about at-home care. Not every physician, but a lot of them didn't give them information about at-home care. They basically said, get an oxygen meter. If your oxygen goes to 92, go to the hospital. Well, we all know that there was a lot of information out there about at-home care, and we could find those protocols, but a lot of people didn't know where to find it because they kind of panicked when they got diagnosed and they were feeling sick and all of that. And so what this bill was meant to do was put a protocol on the website for at-home care. The Department of Health did not like that it listed a particular protocol, so I do not want to run the bill, but I hope the Department of Health is listening, and hopefully they will develop a protocol. I mean, we're in a pandemic. If there's ever a time when it's a good idea for the Department of Health to put a protocol on there to how to take care of yourself when you're first diagnosed with something, it's now. This is the time to do it. And so I wish they had done that. It would have cut down a lot of phone calls to us. I'm not a doctor, and I don't play one on TV. But I did try to, just direct my constituents to doctors I knew in our community who were giving a little bit more attention, or, articles that I had read and studies I had read. But that's really not the way to do it. Hopefully our Department of Health will get on that and get that done. So, Mr. Chairman, with that, I would like to take that bill off notice, but I thank you so much for allowing me to speak my piece, and I hope that makes sense to all of you, too.
Okay, without objection, we'll take that bill off notice.
Thank you.
You also have number 13, I
And
think you
that
told me.
one is off notice.
Okay.
Thank you, sir.
No objections, we'll take number 13, House Bill 2259 off notice.
No, it's number 12, 2506. That's the one that you're referring to. That's a different bill.
Oh, okay. 2506. We will move on to item 13, House Bill 2259 by Representative Harris. He wants it to go to the Hill. No objections. We will move that to the Hill. Item 14, House Bill 2599 by Representative McKenzie. You, sir, are recognized. We have a proper motion and second on the bill. Is there an amendment, sir?
There is not.
Okay. You are recognized to explain your bill.
Thank you, Mr. Chair. And this is a pretty simple bill, but I feel it answers a difficult question, and that's the question of why. As you know, this is my second year here, and last year about this time, my alma mater, school in Knoxville, suffered 4 shootings, five shootings of the high school students. In terms of the state of Tennessee had gun deaths increased 28% compared to 17% nationally. In terms of the average, on average, 111 children died in the state of Tennessee, and 132 women were fatally shot by an intimate partner. Again, the question is why, and all this bill does is ask for data. Is to try to understand how gun violence is a health disparity within our state. So that is the simple explanation of what this bill does, and that's all this bill does.
Okay, do we have comments or questions about the bill from the committee? If none, we will entertain voting to send this to full committee. All those in favor say aye. Aye. Any opposition? I think the ayes have it. I'll call that as any objection. If none, we will consider that passed on to the full committee.
Thank you, Mr. Chair and committee.
Yes, sir. Thank you. We're up on item 15, House Bill 2220. We have a proper motion and second on the bill from our illustrious and highly energetic seatmate on the floor, Representative Hodges. We have an amendment that makes the bill. Do we have a motion and second on the amendment? Have a proper motion and second on the amendment. You have the drafting code, sir?
Yes, Mr. Chairman, 014196.
I get a confirmation up here from the experts, so yeah, we will put, does that make your bill, sir?
Yes, sir.
Okay, we'll put that amendment on the bill. We have a proper motion and second on the amendment. All those in favor of amending the bill as stated, say aye. Any opposition? So approved. We're back on the bill as amended, and you are recognized.
Thank you, Mr. Chairman. So what this bill does is if a veteran's family member presents a disability determination to a person signing a death certificate, that person signing the death certificate will have to take it into consideration. And so what this is really about is as veterans during the COVID-19 pandemic that we've been dealing with, as veterans pass away, a lot of times the person signing the death certificate will just put COVID-19. And they don't account for that veteran's prior history. And so if for example, a soldier gets COPD in Iraq from burn pits, comes back here and dies of COVID-19, he died of COVID-19, but we know an underlying issue was that COPD that he got. If they don't write that down, that veteran's family won't get the benefits that veteran's entitled to. So this would just make sure that it gives that person signing the death certificate an opportunity to look at the medical history of that veteran.
Okay, thank you for the explanation. Do we have any comments or questions on the bill? And I understand we have a question's been called. I understand that you are a veteran, and we want to thank you for your service. So no objections. We'll be voting to send this to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Chairman, Committee.
Yes, sir. Thank you.
Item 16 is off notice.
Okay, we will move on to item 16. House Bill 1971 is off notice. We'll move on to item 17, House Bill 2691 by Representative Johnson. You are recognized. We'd ask for a motion and second on the bill. Have a proper motion. No second. I'm sorry, the bill fails for lack of a second. Thank you. We will move on to item 18, House Bill 1747 by Chairman Jernigan. You're recognized, sir. We have, do we have a second on the bill? We have a second on the bill, motion second. You're recognized on the bill.
Thank you, Chairman. Appreciate that. Members, House Bill 1747 adds quadriplegia to the list of medical conditions that are listed in TCA 39-17-402, in which a diagnosed person is authorized to lawfully possess cannabis oil. Adding quadriplegia to the list could help with the most common side effects of living with quadriplegia, which are spasms, chronic pain, an overactive bladder, and insomnia. Department of Safety is deferred on this bill. According to a recent MTSU poll, 81% of Tennesseans support cannabis use in the oil form in medical purposes. So I live with this quadriplegia every day, and the muscle spasms, for me, especially at night, can become unbearable, and it leads to insomnia. Indeed, it does. And I'm asking for this diagnosis to be added to the list so the commission can look at the study. And I'm just asking for this committee for relief for Tennesseans who are living with quadriplegia. And for that, I'm happy to answer any questions, Chairman.
Thank you for the explanation. Do we have any comments or questions on the bill? If none, we will be voting to send this bill to full committee. All those in favor say aye.
Aye.
Any opposition? So approved.
Thank you, members, Chairman.
Thank you, sir. We'll move on to item 19, House Joint Resolution 742 by Representative Powell, and I do not see him. He said that he wanted to address this, so without objection, we'll roll it to the heel. That brings us to item 20, House Bill 2641 by Chairman Terry. You are recognized, sir. We have a proper motion and second on the bill.
Thank you, Chairman and Committee. This bill really is a continuation of the Cannabis Commission legislation that we passed last year that decriminalized patients under certain conditions. In that bill, we asked the Commission to give us guidance on state reciprocity and medical cannabis access, however, not to include any growing or distribution of medical cannabis in Tennessee. And so I've used their recommendations as a framework for this piece of legislation. This bill, there's an amendment on this bill that I would need to get on. I can explain what's in the amendment.
Okay. Have a proper motion and second on the amendment.
15905.
Okay. Let's go ahead and put the amendment on the bill. All those in favor of amending the bill as stated, say aye.
Aye.
Any opposition? We're back on the bill as amended. You're recognized, Dr. Terry.
All right, thank you. As amended, it creates a patient, caregiver, and physician medical cannabis registry. It outlines acceptable forms of products in Tennessee, approved amounts, and qualifying conditions. It adds safeguards to protect against bad actors. It protects employer rights, and it includes further cannabinoid research instructions for the Commission. The allowable amount that is from here is roughly equivalent to half an ounce of marijuana, which carries a simple possession charge. So we'd be decriminalizing the equivalent to essentially a half an ounce of marijuana for patients that meet this, but this bill does not allow for any flower, stalks, seeds, stems, roots, or vaping. With that, I'll be happy to take any questions, and I believe there's some people here that are wanting to testify.
Do you have testimony, sir?
I do not.
Oh, okay. I think we have several people listed. Let me ask first, any questions or comments from the committee before we go into testimony? If not, we have Jan Byer has requested testimony. You are come forward if you would, Ms. Byer. If there are no objections, we'll go out of session and recognize Ms. Byer. just have a seat and turn on the, push the little button there to turn on the red light and introduce yourself. You'll have 3 minutes. There's a little button, right beside the base. Did it turn on?
Yeah.
Okay.
Thank you, gentlemen, for allowing me to speak on behalf of marijuana. My name is Jan Beyer. I've been in Tennessee for 3 years, since 2019. I previously lived in Colorado, and I previously worked for the Colorado Marijuana Enforcement Division as an investigator. I handled business licenses, I handled individual licenses, I investigated background checks, intensive background background checks and financial backgrounds in order to either accept or deny the individual or businesses to get a marijuana license. Marijuana was legalized in 2013 according to an Amendment 64, of which the public at that time voted 51% to allow it. In 2014, it was allowed to go to full public usage. The first year that marijuana was legal for prescription only, I worked for a charter school along with my husband, and we saw the hazards of juveniles getting access to it. There were 5 individual girls, young girls in middle school, high school, that one of the girls brought in brownies from their parents having medical prescription. Within half an hour to an hour of ingesting it, they were all over the place, throwing up, passing out, that type of thing. One girl was taken by ambulance to emergency room. One girl, my husband, literally hand carried to her parents' car so that she could be taken to the emergency room. I have seen as an investigator a lot of suicides, overdoses, increase in the black market. DEA has been involved. Stuff called looping, which means someone purchases marijuana with a prescription at one place and they can go to another place and get another one. DEA shut those down. I saw a lot of negative stuff. It is very, very difficult to regulate. Cannabis, they call it, the bill it says cannabis. Cannabis is the family. Marijuana is the plant. In the plant, there are over 450 compounds, of which only we know 2, CBD and THC. CBD is the medicinal part of the plant that handles the medicinal, and THC is the psychotic, which can cause schizophrenia and it can increase anxiety disorders. PTSD is not a good thing. My brother-in-law had PTSD. He did marijuana way back when, and he says it did not work. It increased his PTSD. It's not recommended. There is no research that recommends for epilepsy or seizures or pain or anything like that. This is according to the American Medical Association and JAMA. So I ask that you please do not approve this for the citizens of Tennessee.
Do we have comments or questions to the witness? Chairman Jernigan, you're recognized.
Thank you. Did I hear you say that people have overdosed on this?
You're recognized.
Yes, sir, they did.
Chairman.
How do you overdose on marijuana?
The amount of THC can induce a psychosis and to where they can, they commit suicide, that type of thing.
Well, committing suicide is not overdosing.
Overdosing is being saying. That's what the girls did when they went to the emergency room. They overdosed on brownies.
Let me get this just a minute.
Okay.
Chairman, you're recognized.
No, that's enough for
Ms.
me.
Beyer,
Thank you.
is there any answers? Dr. Kumar, you're recognized.
Thank you, Ms. Byers. We appreciate your personal experience and what you're saying. Yes, it is what Chairman Jernigan brought out. It's a often touted belief that you don't overdose on marijuana, which basically means that if you're smoking it, you get to be drowsy enough to that you can't smoke. But edibles are the problem. On edibles, you can take more before it hits you half hour, 1 hour later. So on edibles, yes, overdosing is very well known. Thank you for your testimony.
Ms. Byer?
Yes, you're absolutely right, which is what the brownies were, was basically. And as well as Colorado did ban gummies because that was geared towards the kid market. And kids were overdosing and stuff, and as well as others, because, you know, not like Lay's potato chips, you just can't have one. And as a matter of fact, in Denver, the first year, a gentleman took a marijuana lozenge, and he ended up killing his wife because he did not realize what he was doing. He was arrested, and he's currently serving a prison term.
Speaker Marsh?
Thank you, Mr. Chairman. Ms. Byer, thank you for being here. And in your own words, what would you say that this has done for the state of Colorado? I know it's probably brought in a lot of revenue and it's probably caused a lot of problems. What is the general consensus in the
Ms.
state
Byer?
of Colorado?
Actually, in regards to revenue, for every dollar of sales tax that has been received by the state of Colorado, it's documented that it costs $4.50 for the state of Colorado to enforce it, for education and handling DUIs and suicides, emergency room visits, that type of stuff. So it costs $4.50 for every dollar of sales tax. My biggest concern is the kids. If marijuana is considered legal, it tells the juveniles, the kids, that it's okay. You know, even if it's under prescription, they will have access because it happened in Colorado. One of the biggest things too is the homelessness. Homelessness dramatically increased. The black market. Like I said, the DUIs and the criminal activity, stuff like that, it's documented that increased double digits. Right now, I used to get phone calls from citizens saying, I voted for Amendment 64, which legalized for medical. And they said, you know, I thought it was going to be a good thing, but it's not. It's causing issues in my neighborhood, my city. It's not the same. And they say, what can we do to change that? And I go, well, I'm sorry, you can't put that genie back in the bottle. We should have never done it. Even the gentleman that created Amendment 64 has come out publicly and stated that he wished he would not have done it. And it has not been a good thing for Colorado. And they're in the process of trying to backtrack a lot of the stuff, a lot of the regulations. And actually 75% of the counties in Colorado have refused to allow it in their county.
Speaker Marsh? Thank you very much. Do we have some?
I got one more.
Yes, Chairman Jernigan.
Thank you, Chairman. Are we talking about recreational or medical? Because 64 was medical, correct?
Ms. Byer?
Or
No, what 64 did was the first year it would create a medical. It would automatically create the recreational the year after. So in 2013, medical was legalized, and recreational was legalized in 2014.
Okay. So we're not really talking apples to apples. We're not talking about recreation marijuana here.
No, I know that. Sorry.
Chairman, Ms. Byer?
Yes, no, I understand that. But we saw in 2014, in the Marijuana Enforcement Division, it was still an issue with having to handle the dispensaries and stuff like that with the criminal activity. I mean, we were very strict, requiring cameras everywhere, safes and video cameras and everything like that. If we had outdoor grows, indoor grows, that type of thing. So we were very strict in our enforcement.
Chairman. Is it fair to say that some of the statistics you're throwing out does include recreation? Is that correct?
Ms. Byer?
Yes, sir, it does. That is my experience overall,
Right, okay.
including the medical.
But since we're not,
Chairman.
since we're not talking about recreation, that's not on the board here. I think we'd be joining the other 38 states that do have medical.
Ms. Byer? Go ahead.
During my investigations with investigating business owners and stuff like that for medical or whatever licenses, we allowed outside investment. Originally, it was in the state only, and it got to where they were wanting more investment outside the state of Colorado. So legislator approved outside investors, and so it was my responsibility to vet those people. And I coordinated with others like New Jersey, California, Oregon, Washington, and various other states who had a program after we did too, and they all have issues, and some of them just have the medical.
Chairman.
I'll just say, I just wanted to clear up that the statistics did include recreational. Thank you.
And I think, Dr. Terry, you wanted to be recognized.
Thank you, Chairman. And I think oftentimes there's a lot of conflation between recreational or even what I would call pseudo-medical type of programs. To my knowledge, you mentioned prescription, and I don't think that Colorado had prescription. I don't know of any state that has a prescription. They do have processes by which they can get it. And you mentioned you're from Colorado, is that correct?
Yes.
Okay. And you spoke explicitly about children. Are you aware of a girl that lives in Colorado by the name of Alexis Bortel?
Ms. Byer.
No, I am not.
Chairman.
All right, thank you. And this is, and again, this bill doesn't allow us to grow, doesn't allow us to dispense. It decriminalizes patients that could go to a different state and come back with acceptable forms. So it's not flour, not vaping, anything like that. Alexis, to give you a little information about her, she was from Texas. And at age 7, I believe, she began having intractable seizures. By age 9, she'd tried 30 different FDA-approved medications, none of which were working. Some made her worse. She was given essentially 3 options. Her parents were given 3 options. They could try an experimental brain surgery. They could put her on, I think it's felbamate. I can't know exactly the name of that drug, but it can potentially cause liver failure or bone marrow, could kill your bone marrow. So those are 2 options she had. Or she could have, her parents could take her to Colorado and try a cannabis-based product. And she did that. Her parents took her, enrolled her in Aurora Children's Hospital, got into a research program, which this allows for someone that's in research to be able to have one of these products. By day 30, she quit having seizures. I think she's almost 16 now and has not had seizures since then. And she takes an oil, I believe, twice a day. She has a spray that's in here. So I guess my question to you is, if you had a child or a grandchild that you were given those 3 options, brain surgery, a high-risk medicine, or go enroll in a cannabis-based product or cannabis-based research program to try cannabis, which would you do for your child
Ms. Byer.
or grandchild?
Well, sir, what I would do is I would make sure that I did all of the prescriptions that were available through the FDA, considering nabilone and dronabinol, which is pure THC. Now, THC is the one that would be helping along with CBD, the epileptic kind of seizures. And it says there's no evidence it is better or safer than currently available antiemetics. And this is by the American College of Obstetrics and Gynecology and the AMA, or JAMA.
Doctor?
So she tried the Marinol and stuff like that. And so if you have an aura and you take an oral pill like that, it doesn't really impact your system and stop that seizure in time, so you end up having the seizure, and then you have the effect afterwards. And so that's why she's gone, and she has that spray for rescue, and she has the oil that she takes for maintenance as well. So she exhausted that. So again, I ask you, exhausting all those options, you have those three choices. Which one do you choose?
Ms. Byer?
I would not choose marijuana for dealing with this because I have seen what it's done. I am not a fan of it. I never will be. There are other options, and that's what I would do.
Dr. Terry?
Thank you.
Do we have further comments or questions of the witness? If none, we thank you, Ms. Byer, and we will dismiss you.
Thank you, sir.
We will, I think we had some TBI, I think, requested Mr. Patrick Powell recently of the Department of Health, and we lost him to a higher order, apparently. So if you'd introduce yourself, sir.
Well, I don't want to say that about my good friends at Health. Patrick Powell, Policy Director at the Tennessee Bureau of Investigation. With me is Tommy Farmer, Director of our Dangerous Drugs Task Force. TBI continues to be concerned about the possibility of legalization of medical marijuana in the state. We would like to see it continue to be treated as a controlled substance. We believe that if it is to be treated like medicine, that it needs to go through the same processes that every other medicine does. There are safety and efficacy processes through the FDA for pretty much every drug out there. This has not gone through those processes. We don't have, a fentanyl commission. We don't have a Xanax commission. We do have a cannabis commission. We're treating this differently than every other medicine. And with the impacts we've seen on exacerbating the black market in other states, things of that sort, we would prefer that it go through the normal processes in the FDA.
We have, and sir, I think Mr. Farmer, did you want to speak as well, sir?
Yes, please. Thank you. I would agree. We do have a very established process for approving medicines, and we think this is very dangerous to open up this avenue. And even opening up this avenue, as it has in other states, such as Ms. Byers spoke about Colorado, you open up the opportunity and the potential for using this process to approve other types of medication, which is currently trying to be approved now in Colorado, for example, with LSD for the treatment of PTSD, or psilocybin, Schedule I psilocybin mushrooms in Oregon for the treatment of PTSD as well as other symptoms. He mentioned the black market marijuana groups across the country in these legalized states, which I can tell you from an enforcement standpoint, I've been in enforcement for 33 years. The majority of the marijuana that we are seeing coming into this state are coming from recreational states or they're coming from medical states. We intercepted 100 pounds of medical marijuana coming out of Oklahoma last year. As a matter of fact, in a period of 2.5 weeks, we seized more than 4,000 pounds of marijuana coming from recreational states or coming from medical states coming into the state of Tennessee. In addition, talking to our counterparts in Colorado and California and other states, what they're doing now, we're tasked with, which is very challenging, trying to determine the legality or the difference between a THC, or based upon a quantitation level, a THC of 0.3% or greater or less. Those states are now setting up medical black market marijuana enforcement groups. Colorado being the last of it. They reappropriated 27 drug agents to do nothing but try to address the black market marijuana group, which we work with them on a daily basis. We're overwhelmed, and other states as well, seeing so much marijuana originating and coming and being shipped in. The latest of that, when you take it into an oil setting, the oil setting has taken this to a whole nother level. When we're they're reapplying, and we've got a couple of cases we can't necessarily comment very much on, but it takes it, when you convert something or you synthesize to an oil, even if it's for a medical purpose or originating in a medical or whatever purpose that be wanted, synthesizing those, we are seeing levels of THC coming in at 78 up to 99% pure THC. And we have seen, as a result of those, we've seen more than 41 documented non-fatal overdoses in the state of Tennessee, or severe adverse medical reactions requiring that patient or those patients to be transported to a hospital and or medicalized, where they stay in the hospital. But into those oils, One of the examples, we had 7,700 milliliters, 7,700 milliliters of a high dose THC, or high quantitative level of THC. And that in dosage units equates to about 1.165 million dosage units. And that, when you're talking about those levels, the way they were reapplying it is they were reapplying it, diluting it to whatever that person or that group wanted. You wanted 5%, 10%, 20%, 30% THC. They diluted it with water or something else, put it in a pump sprayer, laid the hemp out, and then sprayed it with the hemp, packaged it, and shipped it. So these are the issues that we open up this potential for, is seeing how we're going to enforce. And we're in an unregulated industry. And the other thing that I would caution is, as Patrick talked about, we watched what an opioid epidemic could be when that is dealing with a closed network of distribution with a lot of transparency and a lot of eyes and redundant services from the state and federal, local, from health to law enforcement, looking at an industry trying to track and regulate the dispensing of drugs. Okay. And when we go outside of this closed network, we are in an absolutely unregulated. The states lack the fundamental infrastructure to regulate, and then we're trying to deal, and it creates a tremendous amount of confusion. Thank you very much.
Yes, sir. I think Chairman Jernigan, you want to be recognized.
So, Patrick, you said you'd rather have it FDA approved to be a medicine. You said that we have an opioid epidemic, which is an FDA approved medicine. You're both saying two different things.
Okay.
No, sir, I think...
yes, Mr. Powell.
And I apologize. Apologize, Chairman. I think, and I don't necessarily want to speak for Director Farmer, but even with the protocols and safety and efficacy process of the FDA and everything else, we've seen the damages that opioids have caused. This doesn't have any of those additional oversights, so we're just welcoming a worse scenario. So, I mean, we would like to see that minimum level of safety and efficacy review by the FDA before approving this as any kind of medicine. Certain medicines have gone through that process. We have the Epidiolex, we have Marinol, we have certain medicines that are out there that have gone through this. This is leaving medicine up to however you feel. There's no set dosing. I mean, you can imagine how bad opioids would be if we allowed you just to say, hey, take however many you feel like. But that's largely what we're doing with the cannabis bill as it stands here. So we would like some minimum level of federal involvement. And again, we just last year, this body passed the bill related to the Cannabis Commission with a triggering event of the feds rescheduling. That has not come to pass, but here we are again, still attempting to go forward with something that has not been approved for safety and efficacy by the feds.
Chairman
Did
Jernigan.
you just say that just on how you feel?
I
Because I,
think
can tell you how I feel at the end of the night. It's not
Pat?
pleasant, and you wouldn't want to be in my shoes. To arbitrarily just say it would depend on how you feel, so you just take the drug. That's offensive to me, anyway. You need to walk a mile in somebody else's shoes that this drug could do something for somebody. And to sit there, look, our intent is not to go recreation. Everybody have drugs and spray all over the state for people. Opioids is much worse, much worse.
Mr. Powell.
I'm
go
not
ahead,
done.
sir.
The intent
Go ahead.
for this is for medical purposes, for people that are suffering, that frankly, opioids is not called, they're the problem. I wish you all would focus more on that than coming in here talking about, marijuana. And no one has ever overdosed on it. Overdose means that it kills you. The intent means that you're going to die. All right? That's what that means. I'm stunned that the TBI comes in here and they're so worried about marijuana when I've got this epidemic out there and we're trying to put restrictions on it, probably the most restrictions in the state. I'm sorry, but it can give a lot of relief to a lot of people just because they feel that they just go out and do it. I don't like that comment. So I'm done talking about this. I'm going to be in favor of this bill, Dr. Terry.
Mr. Powell.
Chairman Jernigan, I apologize. I don't mean for it to be taken that way. We are concerned about the lack of studied dosing and appropriate treating of it as medication. Without kind of proper controls, we are worried about safety and efficacy. Again, we agree with you on the opioid front. We are battling opioid drugs across the state every day. We are battling fentanyl. We're battling it all. But our battling of opioids does not mean we don't battle this as well.
You're recognized, Mr. Farmer.
I would agree wholeheartedly. I mean, there are many things, unfortunately, that we can't cure. We have no cures for cold. We have no cures for cancer, and we totally agree with you 100%. The others, we also see the other harms, and the harms, the unintended harms that it can cause by distracting and taking away from our efforts to combat those and putting something else out there that we're seeing tremendous diversion off of, and the other states are seeing tremendous diversion from. That is the fear. That is the fear that we have, and it's the general public, the whole public, and those consumers that we have that we are focused for.
Gentlemen, you've aroused the dragon.
I don't
Chairman,
want to take away from
Chairman
Dr. Terry, but I'll be tempted to ask you the same three questions he asked the previous person. Given those three items, what would you do?
Mr. Powell.
And I apologize. I was outside for some of that testimony, so I'm not sure what the questions were. I apologize.
Can I yield to Dr. Terry to repeat those
Yes,
questions?
sir. Dr. Terry, you're recognized.
Yeah.
On the questions, I think that Ms. Byer had answered.
Thank you. And the question that was asked was if you had a child or grandchild that had gone through all the FDA-approved drugs and they had failed, even the ones that are THC based and had failed, and you had the options of enrolling your child or grandchild in a research program for cannabis-based medicines or have an experimental brain surgery that may change your child's life forever, or take another FDA-approved drug that carries the risk of aplastic anemia or liver failure, which would you do?
Mr. Powell.
I mean, I personally would want to do whatever was legal and whatever the doctor recommended. I mean, if my doctor was recommending surgery and thought that was the best course of action, then I'm going to trust my physician. I personally would want a legal recourse. I understand that that's what y'all are trying to do. We simply see, obviously, that the feds have considered this a Schedule 1 and continue to consider it illegal. We would like it to continue to go through that FDA-approved process.
Mr. Farmer.
I would say, you know, the feelings and emotions of those family members, any mother, any grandparent, any parent's going to do whatever they could to help them. But on the same token, I wouldn't want to give that mother or that grandparent false hope or a false sense of security that we're going to cure something when something is not there and the science is simply not behind it. That's been shown. That's our fear, and we're looking for public safety and public health and the greater good.
Dr. Terry.
Thank you. Neither one of y'all answered that question, but that being said, when I first got up here, and I'm just going off a little bit here, I was a no on this issue, but I've got a daughter, and I got to talk to Alexis and her family, and I know what I would do. We would be in Colorado or somewhere. My wife would be there. We would figure it out, and we would try that before I'd have brain surgery on my daughter or something to kill her bone marrow or liver.
Any answer from the witnesses? If not, Chairman Sherrill, you're recognized, or Leader Sherrill.
Thank you, Chairman. In my background of being in law enforcement for about 10 and a half years, hearing from Representative Terry and Representative Jernigan here making comments, I hear what they say, but I hear that this is not FDA approved. Is that my understanding? And I think about it, I've heard a doctor say that, if a person comes into their office, if this was to get approved, I heard a doctor say, well, if they come in and want this, how much do I give that person? The doctor says, I don't know. I've heard some people that has been given some of this stuff and it has caused some problems in their body of what I've heard. I don't know a lot about it. But my fear is, and I I think about, I have a son that's 17 years old, and I think about the other children that's around about. I have a very much fear that we are maybe letting the foot get in the door of a problem that we do not need in our society. Marijuana, if you want to say marijuana, you want to say cannabis or whatever you want to say about it, and seeing what I hear about it and seeing it grown, and you got to be very careful about growing this if it gets too hot. Of course, it's supposed to be destroyed, but it don't get destroyed, my understanding. It goes out into the market somewhere, somebody gets that. So there's just so much, I have a fear about allowing this to come into our society, and then we hear about other states that having these problems. Just a little bit cautious about it.
Witness response, Representative Freeman, you're recognized.
Thank you, Chairman. And I apologize for being late. So the reason that this hasn't passed is because of law enforcement, not because of the medical profession. And you have doctors telling people and testifying that this is something that could help their patients. Sir, nobody said it was going to cure anything. Opioids don't cure anything. This is giving people some sense of pain relief. And if you think that it's going to increase, people are using today, or else you wouldn't be arresting them for it. And the reason that you are spending time on it is because you have deemed it a priority, that this is, not you deemed it a priority, but because it's a priority of law enforcement. We have people that are serving time in jail because of small amounts of marijuana. You know, several of the people on this committee know, but the reason that I was late today is because my wife had surgery yesterday for breast cancer, okay? And you're telling me that when her pain gets so bad that I can't do something that I know is going to treat her, that I'm going to have to go out of state, because I will go out of state to treat it because you have decided that you're going to put your foot down and fight this? We need to listen to the doctors.
Response from the witnesses.
And Representative Freeman, sorry to hear that about your wife. And I respectfully disagree on our perspective. We are wanting this to, if it's going to be treated like medicine, we want it to be treated like medicine. We want it to go through the same processes that other medicines do, and it hasn't. We want, if it's going to be used as medicine, we want it to be safe and effective. We want it to go through those FDA processes.
And I want to say how sympathetic we are for your family situation, and our prayers are with you. Don't worry about going out of state because they can't read your license plate when you come back come back over the line. I'm just kidding. I'm on your side on the license plates. Let's see, Dr. Kumar, you're recognized.
Thank you, Mr. Chairman. It's an emotional issue, and it gets personal, as one of our chairmen, as well as our representative, has brought their own personal struggles and family into the situation. For one thing, marijuana has medical or recreational, has no role in acute pain relief, period. There is no evidence, there is no doctor that would recommend using marijuana after surgery for pain relief. No, that is not there. Opioids are there. They're a proven medicine. They have been for a long time. Yes, they have been misused, but there is no substitute for them, and there is no there's no substitute for them, and they are lifesavers. You know, I guess we're talking personal things. My wife had back surgery about 2 months ago. Yes, opioids were a lifesaver. Is she hooked? No, she's not. She's back to Tylenol, and things are getting better. But in acute pain of surgery, there is no substitute for opioids, and they have been misused. And I think partly they have been misused in certain ways. It is frequently claimed that in states that have done medical marijuana, opioid use has gone down. Yes, it has, because the cartels saw that and they lowered, because they were losing people at their customers, so they went ahead and lowered the price of heroin. If you plot a graph in Oregon or Washington state during the time that medical marijuana was introduced, opioid use went down, heroin use went up. It's not that those people who were on opioids basically went ahead and started using marijuana and they were just happy and living fine. No, heroin use consistently went up because the cartels lowered the price. So these are conflicting factors we need to realize. I don't really know what role the opioid debate has in the effects of marijuana on people, on society, and on young people especially. It is well known and well proven that use of marijuana lowers the IQ of adolescents and teenagers by at least 10 to 15 points. That's a classical study. Everybody knows that. And yet to turn around and recommend for some reason that we would give a THC-based therapy to a child, I think that's really, really not in medical science. It's just not the right thing to do. I just wanted to clarify these things. Use of marijuana in childhood is harmful to the development of the young brain, and we know that. Comparison to opioids is unnecessary. Marijuana is not a substitute for opioids, and marijuana is not for acute pain relief at all. I don't think any doctor would recommend that. Thank you, Mr. Chairman.
Okay. Further comments or questions? If not, if there are no objections, we'll go back into session. Thank you, gentlemen. You seem to answer some questions. We're back in session. Yes, sir.
Thank you. I'd like to go ahead and call the question.
Are there any objections to calling for the question on this bill? If none, we'll be voting to send this to full committee. All those in favor say aye.
Aye.
Any opposition?
No.
The ayes have it. We'll send it on to full committee. We're just about out of time. We've got like 2 minutes left. I'm sorry. Chair Lady Moody came back in, but will you come back at 4? We have an extension today at 4 o'clock. We're going to meet in House Hearing Room 3 and take care of the Ramsey calendar here. I think I've got about 5 bills on there, and whatever else is on the heel of the calendar. So we will meet. We will recess until 4 o'clock. Thank you very much.